All right, welcome back. It's Breakfast Daily, and the hashtag is Breakfast Daily on all social media platforms. If you're watching on Facebook, Twitter, wherever you're watching us from, use the hashtag for us to hear what you're thinking. The WhatsApp line is 0550-585-832. Now, Breakfast Daily is sponsored by Skywater and Creamy Plus, so enjoy all of that throughout your morning and the rest of your day. Yes. All right, now, a few days ago, we brought you a story from the Kalba district in the Savannah region. And the health center there had a challenge when the rainstorms came in and ripped up their roof, and there was all kinds of struggles that they're going through. The facility is pretty much dilapidated in many areas and lacking a lot of help, or needing a lot of help. And so let's remind you of the story that we brought to you with a report by our colleague Richard Fogo, and we'll come back and we'll show you the updates and some good news.
The rainstorm on Saturday evening in Kalba in the Solatuna Kaba district of the Savannah region ripped off the roofs of a number of buildings, including the health center. The health center, which is the only major health facility that serves about 40,000 people in 65 communities in the area, has thus been closed down. The facility lost documents, drugs and mattresses among others as the storm ripped off the roof, forcing authorities to discharge patients who were on admission. When City News visited the facility, patients who had traveled from other communities for treatment were stranded. George Sobitey is the chief physician assistant of the center. He warns of a health crisis in the area if the facility is not reopened soon, as the ambulance in the facility has broken down and the nearer health center is over 30 kilometers away on a very bad road.
At this particular moment, looking at the situation, our services is heavily affected because at the moment the whole building is off, the OPD side, the general side, and it didn't also end there. It has lifted the roofing sheet to the maternity block, which is also in danger. At the moment, the central part of it, where the delivery room is, the labor room, is also affected. No delivery can be conducted. So this is serious. It has affected our work here, and we are all traumatized.
Mr. Sobitey also spoke about the effect the closure of the facility will have on the district.
The services we also provide here has covered over 40,000 population, and we serve over 65 communities. It is a referral center where the CHIP compounds and other private facilities, we have a private facility in town here. They also refer cases here to us. So where we are now, we are in a desperate situation.
The Damongo Catholic Diocese Health Director, who manages the facility, Aiden Minbon, said the diocese is overwhelmed with the level of damage and appealed to philanthropists, NGOs, and the government of Ghana, as well as the National Health Insurance Authority, for support to reopen the facility.
Let me say that it is a twin disaster. If you recall, on the 18th of January, we also suffered fire disaster in this same facility that affected the administration block. We are still in process of mobilizing resources to replace that administration block, when just only yesterday this has also happened. And so the burden on us as a diocese is quite enormous, and if we don't get support from our partners and other groups, it will be difficult to really fix this immediately.
Some 78 houses have been affected by the storm, displacing 105 people.
All right, so that's a report there by our colleague Richard Fogo. And you can see that it was quite a desperate situation that they found themselves in. And we brought this report to you a few days ago. And thankfully, there's been an update. And let's take a look at this next report, also filed by our colleague Richard Fogo on some good news that has come.
The St. Joseph Health Center in Kalba serves over 40,000 people in 65 communities in the Solatuna-Kalba district of the Savannah region. Established over 40 years ago by the Catholic Church, the health center is the biggest facility in that part of the district, which is very rural. Authorities of the center were forced to close it down after a rainstorm ripped off the roof of the facility, destroying health consumables and equipment on March 19. Though the facility has started rendering some services to clients with the OPD under a tree, a lot is needed to be done to resume full operations.
We will not be able to provide all the services as we used to, but we will attend to those that we can manage and refer as our profession train us to do, to refer those to the next level. So that is what we have been doing.
Authorities estimate that 102,000 Ghana cedis is needed to refurbish the facility and resume full operations. Following a campaign to get the center reopened by CDTV, Forward Development Africa took the lead to donate 10,000 Ghana cedis toward the refurbishment of the center. Ahmed Yekini is the regional director of Forward Development Africa.
The whole reason why we do what we do is to have people healthy. And the last place you expect to be out of functioning in a community is a clinic. So when this happened and we heard it, and we came and saw the damage, we couldn't afford to put the whole place in a shape or back to how it was, but we thought we could make a contribution and invite others, like-minded organizations who could also support to ensure that we can at least temporarily have the place in order for it to be functioning and provide the health services that is so needed within the community.
The Damango Catholic Diocesan Development Officer, Reverend Father Sylvester Kumbete Sru, thanked the donors and said they are hoping the refurbishment of the center will soon commence with other donations coming in.
We are also working very hard to make sure that I can say probably by next week or so to make sure that some work begins here. The bishop has asked me to assure the chief that with this donation that we are receiving from Forward Ghana, and we are hoping to receive one or the other donation from somewhere else, I should assure the chief that as soon as possible we will try to get this building re-roofed so that our workers, our people may have access to safe environment for health delivery services. So that is the assurance that the bishop has asked me to give you. And so rest assured that it wouldn't be too long. You will see us here again.
All right, so that's the bit of good news. I mean, look, I think that it would be good to see a lot more contributions coming towards this facility. Yes. The people that work there, a lot of them would prefer to work elsewhere in the country because maybe the stress of working with few equipment that you need, you know, you want to get this done, you don't have the equipment for it and all of that. I mean, I hear this from some of my doctor friends, and you know, they complain about the stress of you want to help, but you don't have the wherewithal to help, you know, and so on. So I mean, I'm hoping that this donation will just the tip of the iceberg that they're going to get, you know, and then that beyond refurbishing the property, the premises, to actually, you know, help to upgrade it, you know, with equipment and all of that, you know, we'll have enough money to do that. Yeah, I
think so. And I think, you know, this obviously is a health facility being managed by the Catholic Church.
Yes.
In that area, which is great. And we know that there's a lot of charitable work and projects like that the church does and helps to support government in providing facilities like that, because from what we understand, this is the major health facility
in the 65
serving over
communities.
60, yeah, serving
65 communities,
tens of thousands of people. You know, so it's a crucial edifice, and we need more of such. But I also, yes, we want other corporate entities, etc., to support. But I would also hope that the Catholic Church in other dioceses and other parts of the country, like in Accra, where there are, you know, parishes that are quite well-to-do, could also support. You know, just to beef up what's already been done by Forward Africa. You know, and it could be that maybe a lot of parishes here haven't heard about the situation, because I'm sure many would love to contribute. If they saw and knew that's the situation, I don't think people would hesitate.
So. I mean,
you know, even individual
so.
donors to really help with this.
Yes, I think so. And I think, I mean, look, they said they needed 102,000 Ghana cedis. There's one person
who can do that.
Who can do that very easily.
Yeah, they could. You know, even if it's 10 people coming together or 20, it could be sorted out. You know, or you know, a church could adopt it. A church here could say, "Oh, for our sister diocese in Damongo, let's do this for them." You know, and even other religious entities, not just the Catholic Church, but you know.
No, so honestly, I mean, for me, I want to call on people, you know, to say, listen, these people are out there in Sola Tuna Kalba district. It's far away from Accra. And so it may look as if it's not a problem that bothers us. But I think it's important for us to understand that if some part of Ghana doesn't work, the whole country doesn't work. It's as simple as that. It can't be, we can't look at it in silos and say, well, my house is working, so I'm good. You know, we have to understand that the whole country needs to function. And yes, government can do its bit, but this is a situation where you find that the church has come in to help by setting up a facility. Okay, and it's a facility that's supplying a large area. All right, and so if the church is doing this, and my perspective is that I think it's important for us as individuals to say, listen, okay, there are facilities around that the government has put up. The church has also put up some to support. If they've had a disaster like this that has hit them and they need help, even forget about the upgrading part of it. Let's just refurbish it and bring it back to the state in which they can function and function properly. All right? 102,000, it's not too much. Some of you who are watching right now can easily sign a check to clear half of that bill. All right? So, let's, you know, let's do something.
Look at the things that were destroyed. They talked about medication that they have to now get rid of because it's been contaminated. Obviously, the documents.
I mean, they can't retrieve anything. Once water gets on paper,
you know,
that's it.
And I'm sure they probably don't have enough technology, like computers and stuff, to have digitized files and all of that. Now all of that is gone. And then he mentioned that they had a fire incident as well.
Yes,
so
prior
fire
to
and water have come to really wreak havoc here. They need a lot of support.
You know what I would love to see? I mean, can you imagine the story that some 2 or 3 people come together and say, you know what, let's get in there, let's fix this properly, right? And then we come back 3 months later, 4 months later, the story is different, and they have a fully refurbished and digitized system where they have to even retrain staff so that they can actually handle the new system that will be there. That'll be an amazing story, you know. But we do have
George Sobitey.
Yes, George Sobitey on with us, and he is going to give us an update on what it is. He's the chief physician assistant at that hospital, St. Joseph's Hospital in Kalba. Good morning. Good morning to you, George.
Yeah, good morning.
How are you this morning?
Yeah, good morning. Yeah, I'm doing well. What about you?
Very well, thank you. Welcome to Breakfast Daily.
Yeah, thank you.
All right, so
having me with you.
Yes, so just give us a sense of what's happening at the hospital right now. A few days ago, we got the initial reports of the rainstorm ripping off the roof and all that, and we spoke to you. What's the situation on the ground right now?
Yeah, the situation is still the same. So far, what has been as earlier reported, the maternity block that we have been able to just repair because its damage was too much, and that is where we are just operating to make sure that our pregnant women do not suffer because of their delicate situation. They are
Yes.
the most vulnerable ones. So
Yes.
that is why we pay that much attention. But for the general side, for medical services, it's still the same. We are still operating under the tree.
Okay.
But the fact is that last week, maybe you got the information that one organization,
Yes. Forward Africa.
Yes. So they have come to initiate the process by giving us some donation to start with.
Okay.
In your estimate,
go ahead, George.
Yeah. So the diocese was here. They came to the facility to make a donation, and the diocese was here to receive that on behalf of the facility.
Okay.
And we are still waiting on other people that are also pledging to support.
Okay.
We are actually not just comfortable with the situation because this is a health facility. And looking at its position or its location, people here is far away from any other health facility that they can access health services.
Yeah.
So if this facility has been put in a situation where the people cannot get the services and people are just feeling reluctant, and even the district assembly, as we reported, the DC came here, and that is all. Nothing has been said. I've sent her a letter requesting for support. Nothing has been said about it. The member of parliament has said he also made the promise. And this morning I had discussion with him, and he said he's coming home just to make sure that his commitment is given out to start the process. And the diocese too, because of the way things are going on, upon receiving this 10,000 Ghana cedis from Forward Development Africa, so they are looking to also advance some amount so that the contractor can start doing something. Yesterday, I had a discussion with the contractor, and then I asked him to give her the first estimate that he needs to start with, because the diocese have asked for that, and that is what I'm waiting. I'm hoping to receive that estimate today.
Okay.
So that as fast as possible, something can start doing. So that we are still waiting.
Yeah.
Because this is just as it's happening like this, we hear of the fire that happened first, destroyed some of our equipment. The 812 has also come to destroy all our equipment. Currently, I should have been using a laptop for this interview, but I have to use my phone because all our computers are all destroyed.
Yeah.
We try to repair them, but we cannot be. We are not able to.
So George, just
do that.
Do you have any idea? Of course, you're waiting for the estimates to come, but how far? This is like 10% of what you really needed in the initial ask that you made. How far do you think this can go?
Well, so that depends on the estimate the contractor will present, which I'll send to the diocese, and they will know how much that is needed to top up for the materials that the contractor needs. Okay.
So let me ask you, the initial 102,000 Ghana cedis that you requested, that you needed, that was based on what estimates?
It's based on the re-roofing.
Okay.
just to put the pin back.
Oh, I
Because
see.
if
So
the
it's not
roofing is
even-
there and other things.
So it's not even, it doesn't even include other things in terms of refurbishing the entire hospital.
Not at all.
Wow. Wow.
It's just the roofing.
Wow.
I see.
Yeah.
Okay. Okay. So George, thank you very much. We appreciate your time.
Yeah.
All right. So we've been speaking with George Sobitey, who is the chief physician assistant at the St. Joseph's Hospital in Kalba.
Wow.
Yeah.
So this 102,000 cedis is
It's not
only
even
to replace the roof, like
it's
basically just to cover it up.
Yes, yes.
To protect the facility.
Yeah.
But there's so much more that they need.
And even that, Kokui, I dare say that, you know, the trusses that were pulled off, wooden trusses. I dare say the estimate of 102,
You don't think
it includes the wooden trusses. I think that if we're going to upgrade it or, you know, put it back into shape, you should have steel trusses, you know, which will be even more expensive. So the 102 is really, you know,
They need much more than that. That doesn't even deal with the water damage internally,
you know,
the equipment that was destroyed, the floors, you know. Oh boy, there's a lot to do. You know,
So
the flood
much to do.
damage. It's a lot.
Yeah.
Okay, we need other stakeholders to really pitch in here. You know, corporate entities, like I said, the church itself, in other jurisdictions and dioceses. There's a lot to be done, and again, it just shows how pertinent these efforts are. You know, this is the Catholic Church. We know other churches have done the same, building facilities to support government healthcare delivery, which can't be everywhere. You know, unfortunately, the resources of government are such that you know, interventions like this cannot be ubiquitous. But if the church or whether it's a corporate entity are trying to also do their part, I think it's commendable. As much as possible, we all want to support, you know, even if it's a kobo. You know, whatever people can do, I think it'd be really, really important to support, because looking at this and then listening to him now and realizing that's just scratching the surface. What they're asking for literally is the bare minimum.
Because you know, because the way he said, you know, we're going to ask for an estimate. Then I was like, but wait,
but you already,
we have a figure. So how was that estimate, you know, gotten? It's just for re-roofing.
It's just for the roof. And it's important. I mean, the rains are, looks like they are now getting comfortable. The rains are like, okay, it's our time. We're coming more now.
Yeah. No, and in the
Time is of
north,
the essence.
the rainy season hasn't yet hit.
Yeah. So imagine.
Oh yeah. The rainy season will hit
Imagine
in a couple of months.
When it hits.
You know, and when it hits, it's like 4 months at a stretch. So it's not a joke. We need to get onto this quickly.
Yeah, we do.
All right. So I mean, listen, guys who are watching, wherever you're watching us from, St. Joseph's needs your help. All right. So please reach out to the authorities there and help out. You know, some of you can sign one check and it will solve a lot of problems. All right. So let's do what we can.